Stroke is the second most common cause of death worldwide after heart attack and is the leading cause of long-term disability. 1 in 5 patients of ischemic strokes are caused by narrowing of the carotid artery by the condition known as carotid artery atherosclerotic disease. I am Dr. Sandeep Burathoki. I am interventional neuroradiologist, and today we are going to talk about this condition known as carotid artery stenosis, symptoms caused by it, and its prevention and its treatment. Our brain is supplied by 4 arteries in the neck, 2 carotid arteries in front and 2 vertebral arteries at the back side of the neck. 80% of the blood supply to the brain comes from the 2 carotid artery. Due to certain unhealthy lifestyle and presence of certain risk factors like smoking and high blood cholesterol, bad cholesterol starts depositing within the layers of carotid artery. This fat accumulation is known as atherosclerotic plaque in medical terms. In due course of time, the atherosclerotic plaque causes carotid artery stenosis. Frequently, this atherosclerotic plaque gets ulcerated and rupture, causing the formation of blood clot at that local site, and this blood clot can break into smaller pieces and migrate distally into the brain circulation, causing ischemic stroke. Stroke will present as sudden onset of focal neurological deficit like sudden onset of limb weakness or speech difficulty. Patient may say that he is not able to speak, not able to take the name of the object, or there could be a slurring of speech. Frequently, these symptoms are short-lasting. They may last for 5 to 15 minutes and they recover completely. We say this kind of episode as mini stroke or minor stroke, or commonly they known as transient ischemic attack or TIA in short form. If someone gets this kind of minor strokes, multiple episodes within hours or within days, this could be a red flag sign and could suggest impending major stroke. So one should not delay and should reach out to the neurologist urgently. Sometimes the carotid artery stenosis is so severe that the blood flow to the brain is severely compromised, and patient may have attack of these symptoms while he is doing exercise, or he suddenly stand up, or he is chewing the food. Sometimes these symptoms are precipitated by keeping a long fast or by dehydration, even by vomiting. Risk of stroke depends on the severity of carotid artery stenosis. If the carotid artery stenosis is more than 70%, the risk of stroke is significantly increased and treatment is highly recommended. There are 2 ways to treat this carotid artery stenosis. One way is surgical, known as carotid endarterectomy, and another way is endovascular, non-surgical technique known as carotid artery stenting. In carotid artery stenting procedure, we take a catheter selectively to the site of blocked carotid artery or stenosed carotid artery, and we deploy the self-expanding stent at that place. This stent will expand and displace the atherosclerotic plaque to the periphery of the artery and open the lumen of the artery, and the blood flow to the brain is increased. This is the carotid stent which we place at the site of the carotid artery stenosis. This stent is self-expandable, made up of nitinol, and it is inert to the body and it does not hurt and it becomes a part of the body. Carotid artery stenting procedure is a non-surgical treatment option. It is a safe treatment option, and hospital stay is short, recovery is fast. If you are diagnosed with carotid artery stenosis, do not hesitate to contact us.